One of the greatest challenges facing our communities today isn't a lack of willpower, it's physical inactivity, and it has reached pandemic levels. Physical inactivity is now the fourth leading risk factor for death globally. It fuels chronic conditions like diabetes, heart disease, and hypertension, conditions that disproportionately impact underserved and minority communities. And when you combine inactivity with limited access, low trust, unsustainable wellness options, the result is something even bigger than poor health. It's health disparities, a crisis that cost our healthcare system and our nation more than $35 billion each year. But it costs communities far more in the quality of life and preventable deaths. What's striking is this. For much of my life, I didn't know health disparities existed. It wasn't until I was in my master's degree program that I was formally introduced to something that stopped me cold: health disparities in minority communities. I remember reading the research, seeing the data, tracing the patterns. Chronic disease wasn't random. Physical inactivity was not accidental. Entire communities were being set up to fail, not because they didn't care about their health, but because they lacked access, education, safe spaces, and sustainable opportunities to move. That really shook me. And that's when I realized something powerful. It wasn't just a health problem. It was a systems problem. And systems, when redesigned with intention, can change lives. Today, I stand at the intersection of leadership, science, and service, exactly where my journey has been leading all along. The biggest challenge in underserved neighborhoods isn't motivation, it's environment. Too many communities face high rates of preventable chronic disease, limited safe spaces to move, wellness programs that aren't culturally relevant or financially accessible, health messages that don't reflect real life, and asking people to just do better without changing the system around them doesn't work. So I decided to help redesign the system. Today, my work centers on using movement as a tool for equity, empowerment, and transformation. That means building community-based fitness and wellness programs that meet people where they are, integrating exercise as medicine in healthcare and everyday life, designing evidence-based programs that blend fitness, education, and coaching, and serving populations that are most impacted by disparities. I am also training and mentoring the next generation of leaders and instructors and health advocates. This isn't about workouts or surface level change. It's about building infrastructure for healthy living, one class, one neighborhood, and one life at a time.